Chapter 12 is going to be about patient relations and the dental radiographer. So by the end of this chapter, students should be able to define the key terms associated with patient relations, discuss verbal, nonverbal, and listening skills, and explain how each can be used to enhance communication, to discuss how facilitation skills can be used to enhance patient trust. You should be able to define a relationship of trust between the dental professional and the patient and discuss the importance of first impressions, chairside manner, and attitude, and explain how each can enhance patient relations. Okay, so first we're going to be talking about interpersonal skills, and these include communication skills like nonverbal, verbal, and listening skills, and then also facilitation skills, and we'll get into each of these. So, interpersonal skills are skills that promote good relationships between individuals. Interpersonal actually means between persons. And so, someone who has good interpersonal skills, not only are we talking about those skills when we're talking to our patients, but also when we talk to our coworkers as well. So there's communication, which is the process by which information is exchanged between two or more persons. And we do this through either verbal communication, the words that we choose, and the way that we say them, and also nonverbal communication skills, like our body language and things like that. It's often said that if the two don't mesh, maybe you're saying one thing, but your body language is saying something else, patients will go with whatever your body language is saying. So if you're saying this is going to be okay, everything is going to be fine, but you are distant and you're pulled away from your patient, and maybe you're even, shaking your head no, the patient is going to feel like, oh no, this is not going to be okay. And then listening skills are not just hearing. There's the difference between hearing and listening. When you're hearing someone, the information is coming in, but you're not really thinking about it. Maybe, for instance, you're telling me about how you're struggling with an assignment, but I'm thinking about what I'm having for lunch that day. That is not a good listening skill. So when you're talking to me about something, maybe the patient is saying they have a toothache, then you're thinking about that toothache that the patient is talking about. You're actively participating in that conversation with them. Good communication is the backbone of a well-run organization. Both communication with your patients, with your dentist, with the other members of the dental team. Good communication is how you're going to really navigate all of those relationships. You need to remember that the patients themselves are the key to your success. Getting your patients to come back for you again and again, that is how you maintain a good relationship with your patients, and it's something that you need as a dental hygienist. You need those patients to come back. If every time your patient comes in, or every single time you have a new patient, you don't listen to them, and you push them away somehow or make them feel alienated, then they're not going to come back to your office, and so you're not going to have a schedule, and you're not going to have a job either. So try to keep that in mind whenever you're working with patients, that you want to give them that sense of warmth and acceptance, and you want them to come back for you. And then eye contact is also a part of this nonverbal communication. Different cultures feel differently about eye contact. Here in the United States, eye contact is crucial, and for most people of a Western heritage, they want eye contact, and avoiding eye contact with them is seen as kind of sneaky or shady. And so you do want to do eye contact with individuals like that. You'll find that there are some patients who are maybe from like an East Asian culture, and they avoid eye contact with you, and that's okay. If the patient is avoiding eye contact with you, then that's not something that necessarily you would want to change, but you still want to be available for eye contact should the patient look up at you. And then a lack of communication, or the lack of good verbal skills and good nonverbal skills, that is one of the major reasons that patients will leave a practice. And so they felt like they weren't listened to, or it's not just the dentist either, the dental hygienist. If you're not listening to them, then they don't feel like they are valued, and they'll find an office that will value them. Listening also, it requires a great deal of self-control and concentration. So while the patient may be saying something that you already know the answer to, and you want to skip ahead and give them the answer to whatever their problem is, you don't want to do that, because that makes them feel like you're not listening to them. And so for some of us, especially me, I'm a pretty fast-paced individual. I have a really terrible tendency to try to finish people's sentences. And so that's something that I work on a daily basis as far as being calm and relaxed and patient enough to let the patient finish their sentence, finish their thought before I jump in with my own opinion. All right, so next we have facilitation skills. And the term facilitation actually means the act of making easier. I often feel like this as far as teaching goes, is that I'm not really teaching you the material, I'm just facilitating your learning of the material. And so, I mean, the material is all in the book. If you just read the book, you would probably know more than I could teach you, right? But it's my job to make the process of you learning the material from the book easier. And facilitation skills will enhance patient trust. And so, if we are encouraging them to ask questions, we are answering those questions in a confident and true way. We're giving them the right answers. We are going to respond with action. If this patient says they're cold, we're going to give them a blanket. If the patient says they're thirsty, we're going to give them some water. We're going to respond in a way that tells them that we care about their condition. And also, if the patient doesn't feel comfortable with you, and you're responding with answers like that, and then um, they at the end of the day they say, well, I just want to talk to the dentist. And then that's okay, let me go get the dentist for you. At the end of the day, it doesn't necessarily have to be your communication with them that has to be perfect. Sometimes it's just a matter of making them comfortable, and that in turn will that will positively reflect on you. And then the last one is expressing warmth. This is one of the most important things that I see, that is one of those learned skills, is treating patients like you really care about them. Everything that they say to you, everything that you say to them, it's a relationship, and you honestly you want the best for them, and so you'll do anything and everything in your power to not only give them a healthier oral health, but also making them comfortable, making them feel welcome, making them happy. I've had patients invite me to their Thanksgiving dinners because they feel so comfortable with me, and I make them feel welcome and wanted and valued as a patient. And that is something that really you want to convey to your patients. Okay, so as far as patient relationships go, this is you have your first impression with the patient. You have your chairside manner the entire time you're with the patient, and your attitude and your attitude is going to reflect in each of those first impression and the chairside manner. So we're going to talk about each of these. So patient relations is the relationship you have between the patient and the dental professional. It's not just the dental hygienist. It's the relationship the patient has with the dentist, the one they have with the dental assistant, the one they have with the front desk. And so each of these patient relations, the patient has a different relationship with each one of these dental auxiliaries and the dentist. All right. And so whenever the book uses the term dental auxiliary, it means everyone in the dental team except for the dentist. And so every dental auxiliary is the hygienist, the assistants, the front desk. If you had maybe a hygiene assistant or something like that, those would all be dental auxiliaries. And so the first impression is typically performed by the dental auxiliary. And so well, I mean, realistically, the first impression is when they call and make their appointment, or when they walk in and they see the front desk. That is their first impression of the office. But their first impression of the back office is going to be with either the hygienist or with the assistant that goes out to get them from the waiting room. And so when you go out, you want to first of all be well groomed. You want to be clean, you want your hair to be neat, things like that. Showing up messy or sloppy, that's not going to convey the kind of message that you're going to do quality work in your office. And so you want to be clean, you want to look nice, and you want to have good personal hygiene. Obviously, you don't want to go up there and be stinky, or have bad breath. That would probably be a pretty bad one too. Although right now with COVID, we're all wearing masks, so I guess that's nice. Everybody's keeping their breath to themselves. And then you want to properly greet your patient as well. And so whenever you are going to get your patient, you should already have that information about the patient as far as what their title is. Most offices, when you fill out the form, there is a place for them to choose the title that they want to be addressed by. And so whether it's Miss or Mrs. or Mr. or Doctor or Reverend or sergeant or colonel or whatever they want to be called, then you would say their title and then their last name. Even if the patient is younger than you, you're still going to want to go out and say their title and their last name, because it is the proper way to greet your patient. And so I know some offices get a little relaxed with that. And once you know your patients well, and they're younger than you, or they ask you to call you by their first name, then you can certainly call them by that. But initially, when you're first meeting the patient, you want to give them the title and their last name. And then you always want to greet them in the reception area as well. You don't want to just stand in the hallway and shout to them. You want to introduce yourself as well. And so you'll go out and you'll say, hello, Mr. So and so. My name is Jessica Duncan, and I'm the dental hygienist that's going to be seeing you today. Thank you for coming. Come on back. We're going to go back into the back room. And so, you take them with you then. And so that's going to give them that first impression that not only do they know that you respect them and you're giving them the proper title, but they also know who the heck you are and why they're following you. So next is our chairside manner. And this is the entire time. We bring them back, they sit down in our chair from the entire time that they sit down in our chair until the time that we say goodbye to them and we walk back and clean our room. That entire time is our chairside manner. And that is the way that the dental professional conducts himself or herself at the patient's chair side. We want this to be a relaxing experience for the patient. Sometimes dental procedures and just coming to the dentist in general is a very stressful thing for patients. And so we always need to be calm and collected and speak in a tone that is soothing for our patients. We don't want to be shouting or be too loud or maybe on edge. We don't want our hands to be fidgeting while we're talking to them. We want to be relaxed and we want to be confident and we are in control of this appointment. We want to avoid statements that indicate a lack of control as well. And so maybe the patient says, what are we having done today? You don't want to go, oh, I don't know. I'm just going to do this. And then you don't want to do that. If you don't know the answer, it's okay to say that you don't know, but then you're going to say, let's find out for a second and maybe turn toward the computer, figure out what they're having done that day. Maybe they're having their cleaning with you, but then they're going to go hop over and get a filling done. And so the patient's all anxious thinking that you're going to do the filling with them, and you don't want that. And so, you can go and say, hi, we're going to be doing, your prophylaxis first, and then we're going to have you move over into doctor's chair, and then he'll do the filling after. And so those are the kinds of statements that you want to make to your patient, letting them know this is how today is going to run. This is how we're going to do things. You can relax. You can just hang out. We're going to do all the work. You're just along for the ride. All right. And attitude is the next one. This is the position of the body or manner of carrying oneself that is indicative of a mood. And everyone kind of knows what attitude is, but some of us sometimes have a hard time understanding how our attitude affects the people around us. And so, what you need to remember is that you need to be professional at all times, even if you're upset, even if you're frustrated, even if you're running behind, even if you're really sweaty and hot, or even if you have allergies and your eyes are burning. You still need to behave yourself in a way that is professional, and you need to be courteous to your patient. You need to always, put them first. You're in a service related field, and so we need to be very courteous to our patients and always being kind to them. We need to be patient with them. Maybe they are explaining something that is uh, maybe slightly tedious and we don't want to listen to them, but that is not okay to cut them off or do anything like that. And then we need to be honest with our patients. So if the patient is coming in and they're going to have an SCRP with you, and then they're going over to have three extractions, you need to be honest with them. You need to say, we're going to be doing an SCRP. I am going to get you numb. That's going to involve an injection. And then, you're going to go over to the dentist and they're going to do, those extractions. And you need to be straight up with them. You need to be honest about maybe how much it costs. So if you're there and you find out that the patient needs a different type of cleaning, then you need to be straight up and you need to say, hey, this is going to be a different type of cleaning. You have this condition and this condition and this condition. This is why I think that you need this other. We're going to discuss this with the dentist, but then also we need to take a look at your insurance and see if it's going to cover this kind of cleaning, and it's going to be this much out of pocket. Or you need to be straight up with your patients. Don't ever lie to them or even try to make them feel like you're you're saying something that sounds nice, but then there's a nasty surprise waiting for them. They hate that. Patients hate nasty surprises. They don't even really like good surprises. Just no surprises whatsoever. Um, the dental radiographer needs to be polite and courteous towards the patient at all time. And then some procedures, especially in dental radiography, they're uncomfortable. Putting those films inside patients' mouths, the receptors and the holders, those are not always the most comfortable things. Some patients are going to gag, and some patients are it kind of hurts their tissue a little bit to rest that receptor in there. And you need to be honest with them about that. You need to say, hey, this might be a little bit uncomfortable for just a moment. I'm going to place it in here. We're gonna move this tube head. I'm gonna run and push that button, and then as soon as you hear that beep, we're going to take this back out. I just need you to bear with me for just that small amount of time. It's going to be less than a minute, and so you need to be forthcoming with your patients. All right, so this is a super short chapter because I think it's one of those things that's hard to really describe in a textbook on how to have interpersonal communication. It's something we do every day in between everyone we come in contact with, we have some type of communication with them. So this is something that we're going to be working on forever. Even you could be, a 20-year hygienist, you're still going to be working on your interpersonal communication. And so if you have questions as far as what's covered in this chapter, feel free to put it in the question and answer. If you can always send me an email. You can see me in class, and then if some of you have really great stories, like funny stories about interpersonal communication, maybe a time when a patient misunderstood you or you misunderstood the patient, then I definitely want to hear about that too.